prior to going on and giving you further introductions into other aspects of Medi-Cal, I would like for Linda Salazar to review with you the most commonly asked questions by clients. Linda, will you share with us some of the questions that are often asked by clients to you as it relates to Medi-Cal?
Sure, Ray. I'll be happy to do that. First of all, I'd like to tell you a little bit about myself. I worked for social services for 35 years, and then I retired, and then I started helping clients myself. They would call me and ask them to fill out Medi-Cal applications. And I would get many phone calls from their children. They were very concerned because they didn't know what they could do to help their parents, because they would hear so many things out in the public. They would have question after question. They would ask, how long does it take to get Medi-Cal? Well, it depends. Are you filling the application out yourself? Or are you hiring somebody, an advocate or a specialist? It's quicker if you go through somebody. They also ask, should I keep my other insurance, my supplemental? Yes, you need to keep a supplemental, a drug coverage. They also ask questions like, will Medi-Cal cover diapers? I get questions all the time about, does Medi-Cal cover assisted living or board and care? No, Medi-Cal does not cover assisted living or board and care. It has to be a facility, a skilled facility, where a registered nurse is on staff 24 hours a day. I also would get questions like, are you sure we can gift money from my parents? I don't want to go to jail by taking my parents' money. And I said, yes, you can gift money. There's a way to do it. You need to do it correctly and properly. I can help you with that, or if you're working with an attorney, he or she can help you with that. Can I pay the difference to the nursing home to keep my mom or dad in a private room? They've been in a private room and I really don't want to move them to share another space with somebody else. You know, and I try to explain that to my clients. I cannot make that determination, but that's best determined by the nursing home. And if they have the funds to do that, the facility can determine that with the family members. The other part that I get a lot of questions about, mom and dad have a lot of bills, medical bills that are outstanding, and they're just out of money. And am I responsible as their child, the adult child? Am I going to be responsible for those bills? As their child, as an adult child, you are not financially responsible for your parents' bills. Granted, you may feel as though you were responsible for your parent, but you are technically not financially responsible for bills. Medi-Cal has plans in place that we can go back. Retro is available for retro months. They can go back 3 months. There are other plans in place to help with those bills, and that can be discussed with the Medi-Cal worker. So there are several plans that are in place to help you with old bills. Another question that I hear a lot when families contact me, I heard that mom and dad can't have a house. Well, they can have a house. A principal house is exempt to get Medi-Cal, so they can have a house. Another question that I hear quite often, if I sign the Medi-Cal application, am I going to be responsible? Again, no, you are not responsible. You are just signing to help get your mom or dad on the Medi-Cal program. When I also hear from my clients' children, adult children, when mom and dad dies, am I going to have to pay back everything that Medi-Cal paid for my mom or dad? The state does have a recovery unit, and the state will send a letter. They send a letter to everybody, and there's a form that has to be filled out, and they will determine who has to pay back what. It will be looked at on how the assets were structured, and the state will work with you on how much has to be paid back. You may have to pay something back, or you may not. It just depends on who you worked with and what you did. The other question I get a lot are, mom and dad's in a nursing home. What happens to the bed they're in if they go back to the acute hospital? Is the nursing home going to hold their bed? Yes, Medi-Cal has a bed hold available for 7 days, so they can go back to that nursing home. You don't have to look for another nursing home for them. You know, and I do get a lot of questions, and there are so many questions, and I'm always available if you've worked with me or any other advocate that you've worked with. So, and Medi-Cal is a scary thing, but if you are working with somebody, you know, all you have to do is pick up the phone, whether it be an attorney or a specialist or an advocate, but there is help available. Okay?
Well, Linda, thank you for the response. I think that was very enlightening.